So today I wanted to talk about glaucoma. Um, there's 50 types of glaucoma, so we're not going to talk about all the types of the glaucoma or high pressure, which some people consider to be equal. Now, whatever I say, there's always going to be somebody who's going to say, well, that's not exactly right. So this is a simplified version of what glaucoma is. Whenever we say glaucoma, we usually talk about narrow angle glaucoma, which if you can see right here, this is the cornea, this is the iris, and there's a little bit of the fluid within the eye cannot escape easily, or we can have an open angle glaucoma, which we can see it being able to escape easily. But however, this is, whenever I talk about this, I always liken it to when you're in the shower. When you're in the shower, you can see the water rising, and it could be because of two reasons. Number one, something is blocking the entrance, or there is something inside of the pipes that is blocking the water from leaving it. So if you see something on the top, like your feet being on the, like your foot being on the, in the front of the hole, this is the narrow angle glaucoma. You can actually see that there's a blockage there. But if you don't see anything that is blocking the hole, yet the water is rising, you know that there's something inside of this that is blocking it. These two are, the difference between these two is usually when you have a glaucoma in narrow angles, it could be genetics, but also it could be because of the cataract getting larger and pushing that iris up and therefore blocking this. In most cases, almost 100%, if you do a cataract surgery, the narrow angle glaucoma will resolve. You don't need to do another laser to open up this opening. But in these cases that are open angle glaucoma, even if you remove the cataract, you still get some lowering of pressures. In about 70% of the cases, when we do cataract surgery in an open angle glaucoma, we see a lowering of the intraocular pressure and not doing anything else. The two lasers that we always talk about, and you got to know that there's different types of lasers here that we use for different types of glaucoma. This is for a laser that is for close angle glaucoma that we can just open up, we can just laser here, and basically the fluid can leave right here into the Schlemm's canal, or the canal that removes the fluid. If we see that there's an open angle glaucoma, we make these micro pulses inside of the trabecular meshwork, or essentially where the fluid leaves, to make some openings. This is like rotor-rooter. This is just like taking your foot off the hole and making it open. So it's different lasers. They're both different lasers, and they're both different modalities of opening up both the narrow angle glaucoma or the open angle glaucoma. That in itself is a very simplistic viewpoint of this system, but it gives an understanding of, hey, what are we talking about when we have high pressures, which is equivalent to saying glaucoma in most cases. That's about it.